The early postpartum period can feel like a roller coaster of emotions as your body heals. Fatigue and fluctuating hormones can take the most even-tempered person and turn them into somebody unrecognizable. It's normal to experience emotional changes during this time. The baby blues occur in 9 out of 10 people. Usually, this is short-lived and fades without any treatment. Seek help from your provider if things start to seem out of control. Be aware of your own physical and emotional well-being as you care for your newborn. Be sure to get rest and sleep as often as possible. Accept help from others. Take a break when you need it and don't feel guilty about it. Eat a well-balanced diet. Exercise. Walking is very effective for your emotional and physical well-being. Talk to your partner about how you're feeling. If you're single, find a support person. Postpartum depression and anxiety can develop. Symptoms of postpartum depression usually last more than 2 weeks and can become severe. If you believe you're experiencing postpartum depression, you need to seek counseling from your provider and talk to your support person. There are postpartum warning signs, which will be discussed in depth in the hospital before you're discharged. The first 6 weeks after you deliver is called the postpartum period. During this period, you may experience uterus decrease. After birth, the uterus weighs about 2 pounds, but gradually goes back to a normal weight of 2 ounces. Vaginal discharge. Vaginal bleeding, called lochia, is experienced the first 2 to 3 days following birth. It will be bright in color, medium to heavy flow, and you may also have small clots. Days 4 to 10, this discharge may look pink or brown in color, medium to light flow with few or no clots. Day 11 to day 21, discharge may be yellow or white in color, very light flow, and no clots. These days may vary for each individual person. Call your provider if you soak more than 1 pad an hour for 2 to 3 hours, pass large clots, or still have bright red bleeding after day 4 to 5. If your discharge has a bad smell, if you have a fever that's greater than 100.4, or if you have severe pain in your lower abdomen. Hemorrhoids can be a part of pregnancy for some. If you experience hemorrhoids, you may notice pain or itching around the anus. Avoid straining. Use medications as directed. Cold compresses or a sitz bath may help with swelling and discomfort. Avoid standing for long periods of time. A few things to keep in mind during the postpartum period. You want to eat foods that are rich and high in fiber. Drink lots of water and try to move around as much as possible. Use stool softeners if needed to prevent constipation. A full bladder can push the uterus, which may increase vaginal discharge. Good hygiene is required to prevent complications. Make sure that you're washing your hands frequently and changing your pads regularly. Make sure when you're cleaning from front to back and using antibacterial soap and water. Keep the area clean and dry to decrease your risk for infection. After delivery, topical treatments for perineal pain are available. A sitz bath can help with discomfort. Cold therapy can help with pain and swelling. Take a regular feminine pad, soak it in witch hazel and aloe vera, and place it in a Ziploc bag. Put it in the freezer to get cold and then use that as a cold compress. The witch hazel and aloe vera provide a numbing effect and pain relief. If you like, you can bring these with you to the hospital. After a vaginal birth, you may shower once your epidural catheter is out. If you have a C-section and can walk without difficulties, you can shower after 24 hours when the dressing is removed. Some other important things to remember. With a C-section, a tub bath is not recommended until you follow up with your provider at your postpartum visit. Your menstrual cycle will resume usually 7 to 9 weeks after birth. If breastfeeding, this may be longer. Resuming intercourse or sex is going to take time. You need to have this discussion with your partner and your provider, and wait until you're both physically and mentally ready. Healing usually takes about 6 weeks, but this time frame may vary for each individual. Pain after birth depends on several factors: how you deal with pain, the type of delivery you had, and the length of your labor. Other comfort measures that can help alleviate the pain afterwards include a massage, relaxation, deep breathing, music, and a warm or cold compress. Also, using topical creams and sprays may be an option depending on the type of pain you're experiencing. Your provider may also recommend a pain medication if needed. Remember, you need to call your OB, call 911, or seek medical help if you're bleeding through or soaking a pad an hour for more than 2 to 3 hours, passing large clots or your incision is not healing, red or swollen legs that are painful or warm to the touch, you have a temperature higher than 100.4, an unrelieved headache with visual changes, pain in your chest, obstructed breathing, or difficulty breathing like shortness of breath. If you experience seizures, or if you have thoughts of harming yourself or your baby. It's important to prioritize your health and the health of your baby. Don't hesitate to contact your healthcare provider if you have any questions or concerns. Your obstetrician gynecologist is committed to supporting you throughout your journey. To learn more about Forest General Hospital's Women and Children's Services, visit www.forestgeneral.org/women.